Hey guys, welcome to Medifaction. Today, let's learn about some important minerals in our body and the biochemistry associated with those minerals. The first mineral is calcium. Daily requirement of calcium. An adult needs 500 mg per day and a child needs about 1200 milligrams per day. Requirement may be increased to 1500 mg per day during pregnancy and lactation. After the age of 50, there is a general tendency for osteoporosis, which may be prevented by increased calcium plus vitamin D. Sources of calcium. Milk is a good source of calcium. Calcium content of cow's milk is about 100 mg per 100 ml. Eggs, fish, and vegetables are medium sources for calcium. Cereals contain only small amount of calcium, but cereals are the staple diet in India. Therefore, cereals form the major source of calcium in Indian diet. Functions. Number 1. Activation of enzymes. Calmodulin is a calcium-binding regulatory protein. Calmodulin can bind with 4 calcium ions. Calcium binding leads to activation of enzymes. Calmodulin is a part of various regulatory kinases. Number 2. Muscles. Calcium mediates excitation and contraction of muscle fibers. Nerve conduction. Calcium is necessary for transmission of nerve impulses from presynaptic to postsynaptic region. Number 4. Secretion of hormones. Calcium mediates secretion of insulin, parathyroid hormone, calcitonin, vasopressin from the cells. Number 5. Second messenger. Calcium and cyclic AMP are second messengers of different hormones. Number 6. Vascular permeability. Calcium decreases the passage of serum through capillaries. Thus, calcium is clinically used to reduce allergic exudates. Number 7. Coagulation. Calcium is known as factor 4 in blood coagulation cascade. Number 8. Myocardium. Calcium 2 plus ions prolongs systole. Number 9. Bone and teeth. The bulk quantity of calcium is used for bone and teeth formation. Bones also act as reservoir for calcium in the body. Disorders. Hypercalcemia. Causes for hypercalcemia. Number 1. Hyperparathyroidism. Number 2. Multiple myeloma. Number 3. Paget's disease. Number 4. Metastatic carcinoma of bone. Number 5. Thyrotoxicosis, Addison's disease. Number 6. Benign familial hypercalcemia. Number 7. Dehydration. Number 8. Prolonged immobilization. Number 9 is tuberculosis. And also leprosy and sarcoidosis may also be caused due to hypercalcemia. Number 10. Milk-alkali syndrome. Number 11. Drugs. Number 12. Thiazide diuretics. And number 13. Excess vitamin D or vitamin A. Symptoms. Number 1. Anorexia, nausea, vomiting. Number 2. Polyuria and polydipsia. Number 3. confusion, depression, psychosis. Number 4. Renal stones. Number 5. Ectopic calcification and pancreatitis. Number 6. Blood alkaline phosphatase is increased. In order to manage the calcium level, the following steps can be done. Adequate hydration, IV normal saline, furosemide IV to promote calcium excretion, steroids if there is calcitriol excess, beta blockers in thyrotoxicosis, definitive treatment for the underlying disorder. Hypocalcemia or decreased calcium. Causes. Number 1. Deficiency of vitamin D. It may be due to decreased exposure to sunlight, malabsorption, dietary deficiency, hepatic diseases, decreased renal synthesis of calcitriol, nephrotic syndrome, and anticonvulsant therapy. Number 2. Deficiency of parathyroid. It may be due to hyperparathyroidism, which may be either primary or secondary. Also, pseudohypoparathyroidism may be a reason. Increased calcitonin, which is due to medullary carcinoma of thyroid, ectopic secretion of tumors. Number 4. Deficiency of calcium. It may be caused due to intestinal malabsorption, acute pancreatitis, infusion of agents complexing calcium, alkalosis, decreasing ionized calcium. Other reasons are deficiency of magnesium, increased phosphorus level, which may be due to renal failure, phosphate infusion, renal tubular acidosis, and also finally hypoalbuminemia can also be a reason. Symptoms: muscle cramps, paresthesia, especially in fingers, neuromuscular irritability, and also muscle twitchings, tetany, seizures, bradycardia, and prolonged QT interval are some of the symptoms. Treatment to overcome decreased calcium content or hypocalcemia. Number 1. Oral calcium with vitamin D supplementation. Number 2 is by treating the underlying cause. Number 3. Tetany needs IV calcium followed by slow IV infusion. Also, IV calciums should be given only very slowly. Next mineral is phosphorus. Requirement and source. Requirement is about 500 mg per day. Milk is a good source which contains about 100 mg per dl phosphate. Cereals, nuts, and meat are moderate sources. Calcitriol increases phosphate absorption. Functions of phosphorus. Formation of bone and teeth. Number 2. Production of high energy phosphate compounds such as ATP, CTP, GTP, creatine phosphate, etc. Number 3. Synthesis of nucleotide coenzymes such as NAD and NADP. Number 4. DNA and RNA synthesis, where phosphodiester linkages form the backbone of the structure. Number 5. Formation of phosphate esters such as glucose 6-phosphate phospholipids. Number 6. Formation of phosphoproteins. Example, casein. Number 7. Activation of enzymes by phosphorylation. Number 8. Phosphate buffer system in blood. This maintains the pH of blood. Hyperphosphatemia, which means increased absorption of phosphate. Causes for hypophosphatemia. Number 1 is excess vitamin D. It may be due to phosphate infusion. The other reasons are increased cell lysis. It may be due to chemotherapy for cancer, bone secondaries, and rhabdomyolysis. Rhabdomyolysis is a serious syndrome due to a direct or indirect muscle injury. It results from the death of muscle fibers and release of their contents into the bloodstream. Number 3. Decreased excretion of phosphorus. It causes hyperphosphatemia or increased phosphate content. It may be due to renal impairment, hypoparathyroidism. Number 4. Hypocalcemia can also be a reason. Number 5. Massive blood transfusion. Number 6. Thyrotoxicosis. Number 7. Drugs such as chlorothiazide, nifedipine, furosemide. Decreased absorption of phosphate. It may be due to number 1. Malnutrition, which may be caused by malabsorption, chronic diarrhea, vitamin D deficiency. Number 2. Intracellular shift, which may be due to insulin therapy, glucose phosphorylation, respiratory alkalosis. The next reason for decreased absorption of phosphate are increased urinary excretion of phosphate, which may be due to hyperparathyroidism. Fanconi syndrome could also be a reason. Fanconi syndrome is a rare disorder of kidney tubule function that results in excess amount of glucose, bicarbonate, phosphates, uric acid, potassium, and certain amino acids being excreted in the urine. Also, hypophosphatemic rickets. Number 4. Hereditary hypophosphatemia. Other reasons for hypophosphate condition are hypercalcemia, chronic alcoholism, drugs such as antacids, diuretics, salicylate intoxication. The next mineral is magnesium. Requirement. The requirement is about 400 mg per day for men and 300 mg per day for women. Doses above 600 mg may cause diarrhea. More is required during lactation. Major sources are cereals, beans, leafy vegetables, and fish. Functions of magnesium. Number 1. Magnesium 2 plus is a activator of many enzymes requiring ATP. Some of the examples are alkaline phosphatase, hexokinase, fructokinase, phosphofructokinase, adenyl cyclase, cyclic AMP dependent kinases. These all needs magnesium. Number 2. Neuromuscular irritability is lowered by magnesium. Number 3. Insulin dependent uptake of glucose is reduced in magnesium deficiency. Magnesium supplementation improves glucose tolerance. Causes of hypomagnesemia. Number 1. Increased urinary loss, which may be due to tubular necrosis. Number 2. Hyperaldosteronism or volume expansion. Number 3. Familial hypomagnesemia. Number 4. Increased intestinal loss, which may be due to diarrhea, laxatives, ulcerative colitis, and also nasogastric suction can also be a reason along with vomiting. Number 5. Liver cirrhosis. Number 6. Malabsorption. Number 7. Protein calorie malnutrition. Number 8. Hypoparathyroidism. Number 9. Toxemia of pregnancy. Number 10 could be due to drugs such as thiazide diuretics. Causes of hypermagnesemia. Number 1. Excess intake orally or parenterally. Number 2. Renal failure. Number 3. Hyperparathyroidism. Number 4. Oxalate poisoning. Number 5. Rickets. Number 6. Multiple myeloma. Number 7. Dehydration. Number 8. Drugs such as aminoglycosides. Number 9. Antacids. And number 10. Calcitriol. Iron. Requirement of iron. Number 1. Daily allowance of iron for an adult Indian is 20 mg of iron, out of which about 1 to 2 mg is absorbed. Number 2. Pregnant women need 40 mg per day. Children between 13 to 15 years need only 20 to 30 mg per day. Sources of iron. Green leafy vegetables are good sources. Pulses and cereals also. Liver and meat along with jaggery, which is a good source of iron. Cooking in iron utensils will improve the iron content of the diet. Milk is a very poor source of iron containing less than 0.1 mg per 100 ml. Causes of iron deficiency. Number 1. Nutritional deficiency of iron. Number 2 is due to lack of absorption, which may be due to subtotal gastrectomy and hypochlorhydria. Number 3. Hookworm infection. One hookworm will cause the loss of about 0.3 ml of blood per day. Number 4. Repeated pregnancies. About 1 gram of iron is lost from the mother during one delivery. Number 5. Chronic blood loss. Hemorrhoids, peptic ulcer, menorrhagia may all become reasons for chronic blood loss. Number 6. Nephrosis. Haptoglobin, hemopexin, and transferrin are lost in urine, along with the loss of iron. Number 7. Lead poisoning. Iron absorption and hemoglobin synthesis are reduced. In turn, iron deficiency causes more lead absorption. Copper. Requirement and source. Copper requirement for an adult is 1.5 to 3 mg per day. Major dietary sources are cereals, meat, liver, nuts, and green leafy vegetables. Milk is a very poor in copper content. Functions of copper. Number 1. It is necessary for iron absorption and incorporation of iron into hemoglobin. Number 2. It is necessary for tyrosinase activity. Number 3. It is a cofactor for vitamin C requiring hydroxylations. Number 4. It increases high density lipids and so protects the heart from coronary artery diseases. Abnormal metabolism of copper. Number 1. Wilson's disease. Here, ceruloplasmin level in blood is drastically reduced in Wilson's hepatolenticular degeneration. The basic defect is in a gene encoding a copper binding ATPase in cells. Next is aceruloplasminemia. Here, levels of ceruloplasmin are congenitally low, so iron is not utilized properly. Number 3. Copper deficiency anemia. Since copper binding protein ceruloplasmin is essential for iron transport in ferric form across membranes Copper deficiency affects hemoglobin formation. Number 4. Menkes-Kinkey hair syndrome. It is an X-linked defect, affects only male child. It is a condition in which dietary copper is absorbed from GI tract but cannot be transported to blood due to absence of an intracellular copper binding ATPase. Next mineral is manganese. Requirement of manganese is 5 mg per day. Sources: nuts are good sources and tea leaves are exceptionally rich in manganese. Only about 3% of ingested manganese is absorbed. Functions of manganese: the following enzymes either contain or are activated by manganese: hexokinase, phosphoglucomutase, pyruvate carboxylase, isocitrate dehydrogenase, succinate dehydrogenase, arginase, glutamine synthetase, and manganese-dependent superoxide dismutase. Manganese is an integral part of glycosyl transferases responsible for synthesis of glycoproteins and chondroitin sulfate. Manganese is also required for RNA polymerase activity. Deficiency manifestation leads to impaired growth and skeletal deformities. Chondroitin sulfate generation is impaired so that organic matrix of bone and cartilage becomes abnormal. Hope you have understood the video. Like, subscribe and press the bell button for more videos. Thank you. Thanks for watching.